When I got involved in running home health, it turns out that I had kind of an unusual background. So I'm not a clinician, but I do have a PhD in rehabilitation engineering. So I worked on wheelchairs and prosthetics and things like that. And I also have a background in developing software. So when I started running my group of home health agencies, what I realized was that there was this opportunity to take, and this is 10 years ago, to take software and AI tools, because I was using those in the apps that I was building, to make life easier for clinicians. The opportunity over the next, 10 years after that was that we got really deep into the weeds in terms of what does it take to deliver a perfect chart, and what can we do programmatically, systematically, in terms of our infrastructure to make it easy, to make it automatic, so that it isn't having to just sit clinicians down and lecture at them for 6 hours a month, but we provide them the help that they need in real time as they're doing their jobs, so they get to do what they want, take care of patients, and at the same time have the comfort and confidence to know that they're able to move quickly and with confidence through the documentation process. Our key insight was people in home health spend all their time fixing errors that either they made or somebody else made. And, we called it death by 1,000 paper cuts. Every week we were fixing 1,000 little problems. Something was left blank, some GG question didn't match some 1800 question, whatever it was. And we just never could get ahead. And what we realized was if we're getting information to the clinician where and when they need it, we can also validate data so that all of that isn't falling on QA and all of it isn't falling on the clinicians. We can help them in real time, like, hey, you got to provide an answer to this question or else QA is going to have to send it back to you. Hey, the answer you just entered to this question doesn't make logical sense compared to this, other mobility question you've answered over here. So what we realized was if we can just reduce the number of paper cuts, we can make everybody's life, both for the clinicians and in the back office, dramatically simpler. That process set us on a path of really reinventing the way we conducted home health. And instead of having a process where we're reliant on training people and reminding people after the fact, hey, you didn't follow the doctor's protocol, we started thinking, well, what if we could provide help when and where the clinician needs it? So they're doing their normal work, and we say, hey, this is one of those situations. This doctor wants this many visits. This doctor wants these interventions. That was the aha moment that just made us realize we can do better. And since then, it's funny, but we've been able to pitch our services when we're talking to hospitals in the simplest possible way. We say, we can follow your protocol, which sounds simple, but none of our competitors in the home health space were able to make that claim. They could all get 97 or 98%. They couldn't get to essentially perfect. And that set us apart and allowed us to win all the large or at-risk or value-based plans in our area. That set us on a path for good growth. Now, it turns out that in the process of getting the information to clinicians where and when they need it, we were also able to solve for some other really big problems. It turns out we can also improve the accuracy of the documentation. We can improve the ease and speed of documentation. We can make sure that we're getting the revenue that we have earned by providing the care that we provide. And that translated into a 9% increase in revenue per patient, per period, an increase in the accuracy of our documentation. We had 5 stars at all of our locations, top decile value-based purchasing scores. And we were able to do all that while at the same time reducing the time spent per visit by nearly double digits. And this is across all visit types. This isn't just start of care or something else. And this includes travel time and everything else. So those things caused revenue to go up, costs to go down, and our quality to improve. It was a win for us. It was a win for our patients, and it was a win for our referral sources, the large hospitals in our area.